record. So, good morning, everyone. Here we go. Um, please go ahead and start getting settled in. I'll start with the ringing of the bell. Start by taking a few moments to settle into a comfortable position. Starting with your breath and bringing awareness to it. When and if you're ready, closing your eyes if it's comfortable for you. And if not, having a downward gaze. And bringing your focus to your breath in through the nose and out through the nose. Finding a comfortable, natural pattern. Not trying to control it, not worrying about how big the in-breath is or how long the out-breath is. Just letting it happen. Really noticing the air as it enters through the nose, fills the lungs, expands the belly, and out through the nose with the belly contracting. And observing your body, paying attention to the belly expanding and contracting. Whether there's any tension in your body, in your shoulders or in your core or your legs. And on the out breath, letting that go. Just dropping those shoulders away from the ears. Allowing the arms to get heavy, fall into our laps. Letting any tension in your face just drop and melt away. As you stay with this natural pattern breathing, and working on releasing any tension in your body, you may hear me today talk or use some words of some of my favorite people, Thich Nhat Hanh, Dan Siegel, Rhonda McGee. We're going to borrow some of their words as we do our practice today. And starting with Thich Nhat Hanh, I breathe in, I breathe out. As I breathe in, I am aware of my in-breath. As I breathe out, I am aware of my out-breath. I breathe in, I breathe out. If for any reason your mind drifts or moves away from your breathing, remind yourself that this is normal. This is what the brain is trained to do. And perhaps telling yourself, as my instructor always reminded me, oh, my brain is taking a walk time to bring it back. And with kindness, I bring my attention back to my intention. Taking the next minute without controlling your breath, but just noticing it. Bringing awareness to it without judgment. Just having it settle in. Now bring to your attention one aspect of your outward identity that other people notice by sight or by sound when they encounter you. Rhonda McGee would suggest this could be your gender, it could be your age, or what you may think of as your ethnicity. As best you can, settle your attention on this aspect of yourself, your social identity. Focus in on this aspect of what you appear to be to others. What others might think of you without ever having a conversation with you. And consider this impact. Now think of this impact in a context where you are known, and then consider the impact of this in a context where you are not known. How does this impact how you are perceived? And how does this impact how you are received? What social opportunities are made available to you? And perhaps what social opportunities are not made available to you? Now pause and notice. Dan Siegel would suggest that we notice sensations, images, feelings, or thoughts. He refers to them as the acronym of SIFT, to sift through ourselves. What sensations are you having? What images are coming to mind? What feelings are you experiencing? What thoughts are racing through your brain? Just notice. Are you experiencing any sadness, any anxiety, any frustration, any sleepiness, any boredom, any confusion? Whatever they are, pause and examine why you might be experiencing these. In this very moment, notice if there's been any changes to your breathing or to the tension in your body. Have your shoulders stiffened? Has your core tightened? Has your face changed or altered? And if you notice any of these without any judgment, letting them go, melting away the tension on the out breath. Just coming back to the body and to the breath. And saying, I breathe in, I breathe out. As I breathe in, I am aware of my in-breath. As I breathe out, I am aware of my out-breath. Again, letting your shoulders fall away from your ears, letting your arms get heavy, and letting the muscles and the skin on your face just droop and drop. Letting it just melt. Pausing again, and in Rhonda McGee's words, asking yourself, what were you taught to believe about these social identities, these social aspects of yourself? And what were you taught to believe about these social identities, these social aspects, these social constructs of others? And again, if any sensations or images or feelings or thoughts arise, we don't try to push them away. Let's sit with them for a second, notice them, observe them. And then on the out breath, letting them go. Dropping your shoulders. Letting the arms get heavy. Just letting those thoughts go. Returning to your breath and to your body. Feeling into your belly, expanding and contracting. Noticing your body reconnecting to the floor, your chair, your bed, the earth, and really bringing gentle but focused attention on your breath in through the nose and out through the nose, not controlling it. Just kind, gentle awareness. And let's spend the last minute or two recognizing that it's important to ask these questions of ourselves. It's important to allow these thoughts in. Spending time with our thoughts and our social identity and our social constructs and seeing them for what they are. And then letting them go and practicing gentle kindness with ourselves so that we can understand what social identities we take out there. And not only what we've created for ourselves, but the social identity that we create for others. And pausing and understanding that. I breathe in. I breathe out. As I breathe in, I am aware of my in-breath. As I breathe out, I am aware of my out-breath. Slowly, gently, beginning to wiggle your fingers or wiggle your toes. Maybe rolling your neck. Beginning to stretch. Maybe taking some deeper breath through your nose. Moving those legs. And when you're ready, beginning to rub your hands together and gently creating some warmth. Thanking yourself for the time you took today. Acknowledging the self-care. And putting our hands gently on our face. Namaste, everyone.